Ever wondered how telemedicine compares to traditional healthcare? Ever been unsure about which one to opt for? In recent years, telemedicine has emerged as a significant advancement in healthcare, providing a compelling alternative to traditional in-person visits. But, like everything else, both have their strengths and weaknesses. To make an informed decision, it's crucial to understand the advantages and disadvantages of both. So let's delve into the world of telemedicine and traditional healthcare, and break down the pros and cons of each. Telemedicine has been a game changer in healthcare. But what does it bring to the table and what are its pitfalls? First, let's dive into the pros. The convenience factor is undeniable. Being able to consult with healthcare providers from the comfort of your own home eliminates the need for travel and reduces wait times. This is a tremendous advantage for those with mobility issues or those living in remote areas. Next, we have accessibility. Telemedicine provides access to specialists who may not be available locally, giving you a broader range of healthcare options. You're not just limited to the doctors in your area anymore. The world is your medical oyster. Telemedicine also tends to be more cost-effective. By reducing overhead costs for clinics, telemedicine can often lead to lower fees for patients. Plus, with no need to commute or sit in waiting rooms, telemedicine saves valuable time for both patients and doctors. Time is money after all. Now let's explore the cons. One of the significant drawbacks of telemedicine is the limited capability for a hands-on physical examination. For some cases, this can be crucial for an accurate diagnosis. Technical issues can also pose a problem. Not everyone has access to reliable internet or the necessary technology, which can limit the use of telemedicine. And then, there are privacy concerns. As with any online platform, there is always a risk of data breaches and privacy issues. Finally, insurance coverage can be a stumbling block. Not all insurance plans cover telemedicine, which can limit its accessibility for some patients. It's always wise to check your coverage before scheduling a virtual consultation. So, while telemedicine has its perks, it also has its limitations. Convenience, accessibility, cost-effectiveness, and time-saving are significant advantages. But the lack of physical examinations, potential technical issues, privacy concerns, and insurance coverage issues are important to consider. Telemedicine has its perks. It also has its limitations, which are important to consider. Traditional healthcare has been around for centuries, but how does it fare in today's digital age? First, let's talk about the pros. Traditional healthcare provides comprehensive examination, which means doctors can perform thorough physical exams, lab tests, and procedures that are impossible to carry out through a screen. This can be critical in diagnosing complex health conditions that require a hands-on approach. Another benefit of traditional healthcare is the personal interaction it offers. Face-to-face consultations often build stronger doctor-patient relationships and provide more personalized care. You get a chance to discuss your concerns in depth, ask questions, and receive immediate feedback. Immediate treatment is another pro. Certain treatments and procedures can only be performed in person, ensuring that patients receive immediate and appropriate care. This is especially important in emergency situations or when dealing with serious health conditions. Lastly, insurance acceptance. Most insurance plans fully cover traditional healthcare visits, making it a more universally accessible option. This can be a relief for many patients who rely on their insurance to afford their healthcare. But traditional healthcare is not without its cons. Firstly, travel and time. Traditional healthcare requires travel to the doctor's office, which can be time-consuming and inconvenient, especially for those with busy schedules or mobility issues. Then, we have the higher costs. In-person visits can be more expensive due to higher overhead costs for facilities. These costs are often passed on to the patient, making healthcare more expensive. Wait times are another drawback. Patients often face long wait times for appointments and in waiting rooms, which can be a significant inconvenience. This can be particularly frustrating when dealing with minor health issues that could be addressed quickly. Lastly, exposure to illness. When you visit a healthcare facility, you increase your risk of exposure to other illnesses, particularly in settings like hospitals and clinics. This can be a concern, especially for those with weakened immune systems or during periods of widespread illness. Traditional healthcare, while comprehensive, also comes with its own set of drawbacks. So telemedicine or traditional healthcare, which one should you choose? This question has no one-size-fits-all answer. Telemedicine offers convenience, accessibility, cost-effectiveness, and time-saving, While traditional healthcare provides comprehensive examinations, personal interaction, immediate treatment, and wide insurance acceptance, consider a minor rash. Telemedicine would handle it swiftly, but a serious rash needing a biopsy calls for traditional healthcare. The choice between telemedicine and traditional healthcare depends on your specific needs and circumstances. Now, with a better understanding of both, you can make a more informed decision about your healthcare options.